So, if you had asked me 3 or 4 weeks ago, Arizona was in a little bit of a better position. Our cases looked like they had plateaued, and in some communities were even declining. But most recently, cases have picked back up again, and it appears to be a very different trajectory. Viral spread is moving faster. These effects are showing up in our hospitals and ICUs, and I think it's time to raise the alarm and say something very different is happening in Arizona, and we need to respond to it urgently to prevent a crisis that might unfold if we don't.
In the past, we've heard, well, we're seeing higher numbers because there's more testing and those are coming out positive. But now it is probably the fact that it is being spread because more people are going outside.
Yes, I think the preponderance of evidence suggests that's the case. There was a testing blitz that ended about 2 weeks ago, in which Arizona increased its testing capacity 3 or 4 fold, and so it was a big win for Arizona to get more testing because we needed it. But it did confuse the picture there for several weeks. The last 2 weeks have been relatively flat with regard to testing, yet the number of cases being identified has gone up, and it's gone up fairly quickly. And so it seems to be different from a testing effect. This appears to be real, and that community transmission is on the rise.
We've all heard about the possibility, the probability of a, quote, second wave sometime this fall. Do you think it's something that's already happening in some places, including the state of Arizona?
I do. It's here. A second wave is here. We never actually really fully recovered from the first one. We more or less hit the pause button. Things didn't get appreciably worse, but now they are. And so I think some of it represents quarantine fatigue. I think Arizonans got tired of staying at home, and there's evidence that they were getting out and about more frequently in mid and late April. Then, of course, Governor Ducey relaxed his stay-at-home order beginning May 4th, and then it was rescinded in May 16th. And so I think combined quarantine fatigue plus less social distancing restrictions have basically fueled the fire that we're seeing now, and they are the proximate causes of increased transmission today.
How widespread is this virus approximately in Pima County or the Tucson area? In other words, what percentage of people are testing positive for those who are getting tested?
Yeah, and so right now I would call community transmission widespread, meaning that literally the virus is everywhere. Maybe somewhere between 1 in 250, 1 in 400 Arizonans are currently infected with the virus and are at risk to transmitting it to someone else. But Arizona is not a homogeneous state, and so the risks vary depending on where you live. And so right now, northern Arizona with the Native American nations, that's been a hot spot for some time where many more individuals are infected, and the risk is much higher. Yuma, Arizona is another place that's shown up most recently as having trouble. And then, of course, our large urban areas like Maricopa County and Pima County are struggling as well. And so there's nowhere to escape the virus, but some locations are doing worse than others.
Should we assume that anybody we encounter could possibly be positive for the COVID-19 virus?
Absolutely. That's it's the only sane way and rational way to approach this. And the reason for that is so much of the transmission is occurring in people who have no symptoms, or at least no symptoms yet. And so there was a recent debate about something the World Health Organization said in trying to say how much of the spread was due to asymptomatic people. And so my understanding really is that the largest risk is from people who have become infected, but they don't yet know it. And so, but they're going to develop symptoms. And so we call these individuals pre-symptomatic. And a lot of transmission occurs during that window, and less seems to occur after you have the disease and you might be, oh, I'm not feeling well. Maybe I need to stay at home or take other precautions. And so there's no way to reliably look at someone and go, oh, I should stay away from them because they look sick or they act sick. This virus, it doesn't work that way. We have to assume everyone poses a risk to us, unfortunately.
And what would you recommend to the average person who may be listening to you, watching you right now?
Yeah, and so for the individual, think about their risk profile and how serious it might be if they were to contract the virus. And so those who are over the age of 60 for sure, but also those with health conditions, chronic health conditions like high blood pressure, diabetes, respiratory disease. Right now, they really need to shelter in place. They need to limit their contact with others, including family members, because it's difficult to know who might be infected at any given time, and they're at the risk of the worst consequences of being hospitalized, intubated, and ultimately dying. And so, for those Arizonans, they should take action now to maintain their isolation. I think more broadly speaking, for the rest of us who aren't at risk, mask wearing has to be at the top of our list of things to do. It's not so much to protect ourselves, but rather to protect our fellow citizens, our neighbors, our colleagues, our coworkers, by reducing the amount of virus we might be shedding when we're speaking and having a conversation. And of course, doing all the other things that have been recommended, good hand hygiene, maintaining some physical separation, avoiding crowds of 10 or more. These are all things that we can do as individuals to not only help protect ourselves, but help protect those around us.
Well, thank you and all of your colleagues and all your students for your work, and good luck to you.
Thank you very much. I appreciate your time.